Hare Krishna. So first of all, what is the diabetes? We have to know. What is the diabetes? Is that the irregularity of our pancreas. The pancreas is having two types of cells. That is, one type is an lobular, means ducted. One is ducted, one is not ducted. Ducted pancreas is having our enzymatic preparations, that is called as proteolytic enzymes. That is trypsin, amylopsin, striepsin. These three enzymes are proteolytic enzymes in the ductus area from pancreas, and another is non-ductus area, that is called as hormonal, that is alpha cells, glucagon, and beta cells, insulin. They produce two types of hormones to raise the blood glucose levels, that is glucagon hormone, and one is to control the blood sugar. That hormonal tissue is beta cells that produces insulin. Insulin controls our blood sugar levels. In nowadays, we are using lot of starch based our foods, that is mainly carbohydrates. In olden days, there is no full of carbohydrate diets. So much they are using only high proteins and high fat, low carbo diet. Nowadays, the people are using so much carbohydrates instead of proteins and fats. In olden days, olden India, so much cows are there. Cow gives milk protein supplement, or milk protein supplement, either curd or yogurt, and milk cream, and cheese, butter, and ghee. In olden India, they can take lot of ghees in their all meals, even though in small villages they are having ghee preparations, ghee sweets, and ghee varieties of almost all food habits. In modern India or modern practices, they are not having any kind of ghee substances. That's why we are having to think back of our ancient food habits. So in modern India, they are using so much, more than 80% of carbohydrates. That carbohydrates should not contain no fiber also. So suppose you have to take rice. Rice is not having any kind of fiber. Even though 0.5% is not having fiber in rice. You take wheat. Wheat is containing only 0.5% of fiber. So there is no fiber. We are not having regular bowel habits. So in the main problem, so many persons are having piles, fistula, fissures, and anorectal problems. They are having so much constipation, gas, or belching, and acid peptic disorders, and ulcers in mouths, and ulcers in gastric troubles, indigestion problems, or diarrhea, or they are another problem is developing, that is IBS, irritable bowel syndrome. These all are having, the main problem is by rice or carbohydrates or wheat. wheat is so many varieties. Wheat, suppose you have to take buckwheat or dalia or flour or maida. So many problems is arising from these kind of carbohydrate diets. If we take maida contains zero fiber. There is no fiber in maida. So that's why the maida is very dangerous for our health. And maida, so much chemicals are treated with maida. So we have to avoid the maida, and next we have to avoid wheat also, and rice. Rice is 0% fiber. Why? Because in olden days they have to get directly from paddies, and they hand pounded. They are in hand pounded rice, that is called as brown rice. So we are now modern India is taking rice, that is, repeat, pause. Modern India, they are taking complete pesticide managed rice. The farmers are having so much, giving pesticides and so many chemicals on the fields of rice. So this is the main problem. The rice contains so much chemicals and pesticides, it may causes diabetes. So the people having the rice is very tasty. Why? Because the rice contains no fiber. And nowadays all factory members or all the manufacturers, they are giving to parboiled, means so in parboiled so much excretion will gone. That's why there is no nutritious values in rice. So we have to take, even though simple rice, that is the best for raw rice. Otherwise we have to avoid rice. So there is no rice and wheat. What should we eat? So we have to eat millets. You are thinking that is the millets is bajra and jowar. Okay, bajra and jowar is okay, but another millets are there. That is a very good millets. That is barnyard millet and proso millet, kodo millet, little millet, brown top millet, and these five millets are best for us. Why? Because these millets containing normally grown, and they cannot take such water by the growing of fields. Suppose we think the wheat consumes more than 40,000 liters of water per kilo, and rice consumes more than 20,000 liters of water per kilo of rice. Instead of these 20,000 liters and 40,000 liters of water, millets is consuming only 400 liters of water. That's why this is an eco-friendly. It grows only 100 days only, and this contains, brown top millet contains 14.2% of fiber. We are discussing about diabetes, what to do, what to do not to do. So first of all, please listen carefully. Don't to do, that is, don't take rice and wheat any kind of cereals, any kind of sago, and any kind of carbohydrates like biscuits, chocolates, sweets, and pulses up to 100 days. Meanwhile, you have to take your diet as 70% of ghee or fats, and instead of 30%, 20% is protein and 10% is carbohydrate. And don't take refined oil and refined salt and refined flour. And next, don't take any kind of fruit up to 100 days. So one formula is there, that is, we are taking so much carbohydrates in our life. More than 90% carbohydrates and only 10% proteins and oils in nowadays. That's why all are becoming diabetes. Why? Because the carbohydrates management is very huge to our pancreas. That's why the modern life, there is no exercises and there is no movements of body, in the indefinite food habits, so much different types of foods, they are causing diabetes. That's why I am having one formula, that is 70% fat, 20% protein and 10% is carbohydrate. So I am explaining that 70% of fat, that is, you take every day 80 grams to 100 grams of raw coconut oil. Coconut oil having a good medium chain fatty acids, that is lactic acid, capric acid, caprolic acid. It's very good for our health. And next, we have to prepare all kinds of our vegetable curries and soups. So no adding of sugars and jaggery. And even though cashew nuts, there is no cashew nuts for 100 days. You can eat as nuts, just like almonds, sunflower seeds, and walnuts, flax seeds, pumpkin seeds. So these all are just, you have to fry little bit ghee and you have to take nuts. And meanwhile, you take every day 10 to 15 cucumbers. You cut and you take whatever you have hunger, you have to take cucumber also. And another thing is the cleansing of body, that is, you take every day 3 lemons in a 3 liters of water minimum. So it can be your body cleansing is very good for this lemon juice. But you don't add in lemon juice salts and sugars. So this is the most important. Up to 100 days, don't take any carbohydrate diets. You can take only sabjis, means you can take only vegetable curries, or you have to prepare only veggies and all kinds of soups you made. Coconut oil is the best source of our protein and fat source. Coconut oil should be our own cold pressed oil. And ghee, in the sense, the ghee is indigenous cow ghee only, that is a Bologna method, there is no milk fat. So Bologna method is nothing but we have to put together in mud pot, the milk will to add curdle, and after curdling we have to prepare buttermilk. After buttermilk, we have to take that milk fat, that is cream. The cream will heated, that is the best ghee. This is the Bologna method. This is hand churned ghee is the best for. Soups, in the sense, we have to prepare all kinds of soups. You take 5 liters of water and put together what you call cabbage, cauliflower, and without seeds, beans only, just skins only, and you add 1 to carrots, no beetroot in the soup, and you boil it up to. You can add some leafy vegetables, just like 1 kilo of leafy vegetable, and you add some little bit pinch of salt and pepper powder. You have to boil. After boiling, squeeze all kinds of residue and filter it. That clear soup will have. Again boil it, and at the time of boiling, you add little bit more butter. What you want butter, you add up to 50 grams of butter, and cheese, and you have add paneer also. Paneer you can take 150 grams to 250 gram in a day, and butter 100 grams to 150 grams of butter, and cream, and paneer. So in our formula, 70% of fat, in the sense, we can take that our fat that is most important as coconut oil is 80 to 100 grams in a day as divided dose. Suppose you take 10 grams and 10 grams and 10 grams up to whole day, you have to start. And another thing is, you have to take little bit 30 grams and 30 grams and 30 grams in a whole day. And lastly, habituated, you can take direct single dose. And another thing is, the fats comes from most important, that is the ghee. Our Indian cow ghee. You can take ghee with chance, and ghee like you can take as season with direct salads of vegetables, and you can take directly. And you can take paneer also. Paneer is not recommended in Ayurveda, and butter also, cheese also not recommended in Ayurveda, but there is no chance to this food restrictions. That's why I am recommending paneer as made by your own kitchen. Suppose we have to take in paneer in outside, they can some adulterate with any kind of flour. So that flour is most contraindicated in this diet restriction. And next, our makhan is best for our option. Makhan is nothing but you have to churn our cow curd, and you have to give some water, and that may be buttermilk, and your buttermilk churn, the makhan will come. You can take makhan up to 100 grams, and don't take potatoes, sweet potatoes, and mutter, and any kind of dals, all urad dal, Bengal dal, and Bengal gram, and Odrid dal, or next any kind of dal. Don't take any dal up to 100 days, and you take first every day as tea, herbal tea. I am recommending that, giloy. Giloy is the best anti-diabetic drug. You can take up to that stem 6 inches to 8 inches as divided. You cut it and give 100 ml of water, and you boil it. After boiling 5 minutes, you can filter it, and you take every 3 days. You have to continue up to 3 days. And next, parijata leaf. Parijata leaf, you have to take 10 parijata leaves, and you add some little bit of pinch of salt and pepper powder, that is also recommended for 3 days. This is the best home remedies for this diabetic patients. Ayurveda says Arbuda Chikitsa. In Ayurveda, so many Arbuda Chikitsas there, that is called as nowadays cancers. So many cancers is having so many problems creating. So I am recommending that don't take any kind of sugars, white sugar. This is the most important to stop, and avoid milk. Milk and milk products. Milk is only recommended for cow grazed and organic milk, that is ahimsa milk. This milk is recommended for only deshi cow milk only. And if in case of there is no deshi milk, you have to stop that milk products. And next, ghee is the best source of the increasing our immunity. And think positive. You awake early morning and do some yoga and pranayama, and next some walking, swimming and running. This body maintenance should be done up to 1 hour, and go for any medication and meditation. You go temples, or even though you can take some japa. And I am recommending, this is the special drugs for cancers, all kinds of cancers. You know Giloy. Giloy is the Tinospora cardifolia, Amruta. You have to take fresh stem of Giloy. Each one is 1 feet, means 12 inches long. That is, you take 1 or 2 pieces and cut it, and you take fresh boiling, up to boiling 5 to 10 minutes. You take 100 grams of or 100 ml of water, and that should be filtered. You take regularly morning and evening. That the decoction should prepare morning and evening. This should be continued by 3 days. After third day, means third day means fourth day, you take dhurva, grass. You pick up to your fist and wash it, and you decoction it. After decoction, you put filter and take up to 3 days.
Decoction is boiling it and
yes,
to make it kada?
Yes. This is the decoction in the sense you put just 5 to 10 minutes boiling only. Just you have taking just tea is there, na? Just like tea. And you add each decoctions little bit pinch of tala jagari. Palm jagari. You add it by that for the taste and better improvement of immunity. And third is the parijata leaf. You take 10 to 15 parijata leaves and again boil it. After boiling, filter it up to 3 days. This is the enough for 3 days. 3 decoctions. And fourth is the most important. This is Vinca rojia. You search in Google Vinca rojia, just like red color Vinca rojia. You take the root of Vinca rojia, little 6 inches maybe or 7 inches Vinca rojia stem root, and cut it as small pieces. You do decoctions, and this decoction you have to take 3 days. Again you have to starting decoction. This will help for all cancerous patients. In psoriasis, in Ayurveda they says Kitiba Kushta. This is the different kinds of Sannipata Kushta. Vata, Pitta, Kapha is mingled with the psoriasis cases. First of all, the psoriasis case having psychosomatic disorder. Psycho means their mind also. We have to treat mind and soma means body. Body, you have to maintain the vata pitta kapha balance, and mind is sound sleeps, and there is no tensions, there is no anxiety. We have to take regular meditations and general exercises, so on. And for psoriasis, we have to take regular decoctions, that is mainly useful Amruta Kashaya. Amruta is nothing but Tinospora cardifolia, giloi. You take giloi 6 inches stems to cut it and boil it for 5 to 10 minutes. Filter it. After filtering, you add pinch of Talajagari. You take every 3 days. And next is the clear neem patta, means neem leaves. You take neem leaves just like your fist. It can be maybe measured as 20 to 30 grams. And again you boil it as a decoction. You take regularly. This is the best remedy for psoriasis. And another third is that is haldi. Haldi is the best antimicrobial and antifungal activity. So you have to take same just like a haldi decoction also. This should again and repeat this 3 days. It can be cured for psoriasis.